Hello, everyone, and welcome. We are going to get started in just a moment. We want to give people a chance to get in and get settled. Welcome, welcome. We're going to hold on for just another sec, just to give people a chance to get logged in. I know they're probably rushing home and all the other good things that happen at the end of the day. Drop your name in the chat or whatever you want to share with us, where you're joining us from. We'd love to know what brought you here today. Are you an expectant mom? Are you thinking about becoming a mom? Do you support and care for migrating people? Be with us today. And if it's just because you were bored and lonely, welcome. We welcome that too. Welcome again. We are so excited to have our panelists here. We're excited to have you here. If you didn't know which workshop you were coming into, this is called Ready, Set, Go, a pre-pregnancy pep talk. I am so humbled and so excited to introduce you to our panelists. You saw their bios online, but I always say words on paper cannot express the incredible work and passion that our experts bring to the table. You'll have to forgive me. I've had like 2 caffeinated drinks today. And I don't usually drink coffee, so I'm probably going to be bouncing off the walls pretty soon. But it's also from excitement to see that there are so many of you here to join the conversation. We'll have Q&As at some point, whenever the panelists decide they want to talk. But before that, I want to introduce you to our panelists, Dr. Janet Williams, Katherine Sylvester, Charity Bean, and Mikayla. I can't say it. I'm not going to do it. I've been practicing, Mikayla. I'm sorry. Say it for us.
It's okay. Guerrier.
See, I can't do it. From the
You know,
South,
like,
my tongue will not.
You know the water Perrier, just with a G.
Guerrier. And I
There it
kept
is.
thinking, you had told me how to say it before, and I should have put a sticker up here. It's down here, Perrier. But then I was thinking, did I need to order bottled water? That's what happens when you're older. I missed it. But while we're talking, Mikayla, why don't you start off by telling everyone what you do, who you are, and why we stalked you?
Yes. I like that. Stalked. I like that. So hello everyone. My name is Mikayla. I have my master's in public health. I am currently an outreach coordinator for a nonprofit civil law firm, which sounds completely left field to why I'm here. But my background is in maternal and child health, with a specialization in Black maternal health. So I absolutely love talking about this. I'm also a breastfeeding counselor. I am on the way to becoming an IBCLC, so everybody wish me luck, pray for me. But I'm very, very excited. I love the work that I do. I love working with women and making sure that they know that they are able to stay healthy, both before their pregnancy and during their pregnancy, and even afterwards. So I'm so happy to be here. Miss Marie, she kind of sent a message to me on LinkedIn, and I agreed before she even asked. So I'm happy to be here.
Thank you. And we're not Miss Marie. We're gonna pretend I'm not old enough to be that yet. I'm from the South where they say, like if a woman hits a certain age, she had to wear a hat to church. I'm telling my age now.
Ah,
You had to wear a hat every Sunday, and she was Miss So-and-so, and I refuse. I'm still pretending, although my daughter is probably old enough to be some of y'all's mama, I'm still pretending that I'm still not in that category yet. Dr. J, I will call you Dr. J.
How are you? Hi, everybody. I'm Janet Williams. I am a midwife. I have been with Marie since the beginning of Safer Births 3 years ago. This is our third year doing this, I think. Um, I love to share information. I worked in a municipal hospital in New York, and I love the population that I worked with. And I've left clinical practice in 2023, and I had to do something. This information that I hold inside has to be shared with my community also. It's not something that you can keep to yourself. That would be a crime. So at this point, I am sharing it with whomever. I've met some awesome people online. These ladies on this panel, I'm just amazed at what everyone's out here doing. And it's just wonderful to find your village and to help um, elevate the knowledge that women have.
Thank you, Dr. J. And I'm dropping Dr. J's link in the bio. She's too modest, but after spending many, many years in PR, marketing, and sales, I'm not modest. I will pitch a lot of things. Not pitch, I pitch what I believe in passionately. And one of the things I really, really love about Dr. J, beyond her amazing energy, is the phenomenal book that she's written. She has a second one coming out, but she has a book that is a reflection journal for mamas. And as we talk about preconception, the next workshop, we're going to talk about postpartum. And I just think this journal is so important because we cannot emphasize enough the importance of mama's mental health, as well as her physical health. And this book is just a great little guide for that new mom. So those of you who are here because you've got daughters and are daughters in love, or granddaughters who are who are expecting, go to Dr. J's site and get that book. I think it's a beautiful gift. Speaking of gifts, the other person on our panel that I love the work that she's doing, and I want everybody to have one, is, and I should call you Dr. Katherine, but you truly are young enough to be my granddaughter, so that one's a hard one. But Katherine, Dr. Katherine Sylvester, Katherine, tell the folks about your work and why I am so excited about what you all are doing at Operation MIST.
Thank you. So everyone always asks what does MIST stand for, so I guess I should start there. MIST stands for Monitor, Intervene, Survive, Thrive. And that's for pregnancy, or Monitor, Inquire, Suggest, and Test. And that is for outside of pregnancy, because you can use smart devices for health anytime, and not just when you're pregnant. So that's what we do. We teach women to use technology, whether it's a smartwatch, a blood pressure cuff, a glucose monitor, anything that can give us a number. Oh, can you hear me?
I was trying to do my audio, so it's okay. It's not just me. Yes.
Can you hear me now?
Yes,
Yes.
that's perfect.
Yay! Hi, I'm so sorry, you all. Thank you so much for having me. I was just saying that we teach women to use smartwatches to have smoother cycles, safer pregnancies, and better health. So we teach them how to use any number they can have access to have a safer and smoother womanhood journey. And everyone asks what MISS stands for, and I always forget to say it. So MISS stands for Monitor, Intervene, Survive, and Thrive. And so we essentially teach women to use their baselines or establish their baselines. And in that way, we can know when they deviate from what's normal for them. And then they can course correct with a lifestyle modification if they're outside of pregnancy. And within pregnancy, if we catch something between office visits, they can call in and get intervention before things get out of hand. So we essentially love on women intentionally. We always say that it's the smartwatch plus the sisterhood that creates the better birth and health outcomes. So that's what we do. And I'm affectionately known as Dr. Kat, the mommy monitor, but I love
Okay.
that's fine.
I love it. I took after I stalked her, I do a lot of stalking on LinkedIn. I guess there's a theme here. After I met Dr. Kat, I told her, I said, my grandchildren are 6, almost 6. Had I known, it would have been a resource that there would be no question. We would have gotten this for my daughter just for that peace of mind. And I always, a lot of times a lot of my friends are physicians because of the work that I used to do. And they will say, I wasn't taking care of my wife. Even if I'm an OB, I was not her OB, right? I don't want to be the OB for my daughter. I don't want to, you're too emotionally connected. So even if you do know how to read a blood pressure cuff, although I did not, I thought I did, but then as your mind is like, so having that extra resource like Operation Mist, like Navigate Maternity, which is another partner that we have, we just think is so important. And another tool that I did get from my baby girl was a doula. Not that doulas are tools, but a resource. And so that leads to the last member on our panelists, but certainly not least because there's so much that doulas do to support mama and the family. And so Charity, tell us about your work.
Hi, everyone. I'm Charity, Bean, better known as Doula Bean. I am the founder, president, and CEO of the Doula Lab, which is a pregnancy resource center located in Belleville, Illinois, right outside of the St. Louis metropolitan area. I'm also a student midwife, lactation counselor, full spectrum doula, trainer, you name it. I pretty much do all the things, all things surrounding maternal and infant health. My goal, as I always say, is to rebuild strong Black families and to help empower, educate, and support birthing families throughout the entire preconception all the way into the postpartum period. So that's a little bit about myself, of course, bi-state maternal and infant health advocate as well. I love being in those spaces to help not only open those doors for myself, but for others to come along, because a lot of times you feel like, oh, I'm just a doula. But as a doula, your voice is powerful. You can advocate in more spaces such as legislation, helping pass bills, and helping promote birth equity. So that's a bit about me. Thank you.
Thank you, Charity. So I think one of the things one of the things I'd love for us to do is, we've talked about the work that you do, but I also know as a lay person that some of us don't necessarily know what is a doula. So Charity, will you share with us what is exactly a doula and what isn't a doula?
Absolutely. And that we tend to get mixed up all the time, like a doula and a midwife. Both have a phenomenal and very, very important role in the birthing space, right? But as a doula, the simplest way to put it is you're a non-medical professional. You're still a professional in the health, in the birthing experience. However, you don't provide medical care. That is where the midwife or the physician who is an OB or so comes in. That's their job. Our jobs as a doula is to educate. And that's educating on the process of pregnancy, throughout the labor and birth experience and into postpartum, helping with advocacy, helping you with informed choice, informed consent, helping families navigate that experience throughout that entire experience, and being there more of an emotional support as well as that physical support during, of course, labor and even showing up in the postpartum experience. There are many realms to a doula. You kind of, some of us, like myself, is full spectrum, but I just happen to enjoy and love specializing in hospital birth and making that space safe, because that's where a majority of us are giving birth. So it's like, why can't we have the birth we desire in that space. So the biggest, I would say, difference between the two is, of course, the midwife does provide your care as far as your, your maternal actual health care. That's your provider. And as a doula, we're there with you, showing up, as I always say, however you need us to show up. Some people call me your fairy birth godmother, your birth bouncer, whatever you need. That's the space that we show up in, and we hold that space and we create that safety in that birth experience.
I love that, birth bouncer. And so while we're talking about roles, and you touched on it a little bit, midwives. And I know, Dr. J, you've caught how many babies before you retired?
It was more than 900.
Yeah. Yeah. So influenced a lot of beautiful experiences. Dr. J, talk to us about what is a midwife. I think for me, in the US, we haven't talked a lot about midwives or midwifery or the care of midwives. And so what do midwives do?
Midwife is a person who is specialized in the birth experience in women's health. I am a CNM, which is a certified nurse midwife. There are 3 different distinct types of midwives. I'm in New York. We have CMs, which are certified midwives that are not nurses. We have CNMs, which I am one of, which is a certified nurse midwife, which just means that I was a registered nurse before I went to midwifery school. It's a graduate degree. There are also CPMs, and that is another line of midwifery. Those midwives do deliveries in birthing centers and in the homes. So they more are out of the hospital births, whereas midwives that are CMs and CNMs, we can be in any of those 3 environments, in the home, hospital, or in a birthing center. But basically, we take care of women. I take care of women from the time that they are going through puberty all the way through menopause, which is awesome. And a lot of people don't realize that we do full scope primary care for women. So you can come to us long before you're pregnant. Women bring their daughters to us to talk about their menses and to help teach them things that the mother's not comfortable maybe teaching. We take care of women all the way through their early adulthood. We do pap smears, we do STD testing, we do physical exams. I see moms once a year for their job exams, their physicals, that kind of thing. We give birth control. We take care of any kind of infections, STIs, anything like that. We treat, we prescribe medication. So we're not just taking care of pregnant women. We can take care of women that are on this whole spectrum of womanhood. So that's what we do. We take very good care of them, and we are very holistic in thinking. So we don't just see them as a patient. We see them and their whole lifestyle, and we look at where they live, what they do, what are their dreams and aspirations. We want to hear the whole thing so that we're taking care of her and the family in a complete way.
You, Dr. J. And speaking of holistic care, I know, Mikayla, we made an assumption that people know what an IBCLC is. And there may be some understanding around, maybe a need, because I haven't read all the chat where people said, whether they're new mamas, expectant mamas, thinking about getting pregnant, but let's talk about the role of lactation. What is lactation? Because I know where I grew up, we didn't even talk about lactation. And
Listen.
what is it, right? And then what exactly is a lactation professional?
Yeah, so excellent question. Lactation consultants, these are healthcare professionals who specialize in just providing you guidance in the process of breastfeeding. So when we're talking about lactation, we're essentially saying breastfeeding too. And these people, their roles are so, so important because there's so many women who underestimate breastfeeding and what it's like. Now, I can't speak from experience now, but from the women that I have coached and I've spoken to, it's tough. And you really do need someone to kind of hold your hand and go through that process with you. So lactation consultants, they can show you, what position should you be in when you're breastfeeding? So you're not hurting your back or you're not hunched over. They can look at a baby's mouth to see, okay, is there a tongue tie there? Or why isn't the baby latching properly? Maybe if your milk flow is a little bit low, they can figure out, okay, what are the reasons why? Is it stress? By the way, for anyone who is interested in breastfeeding, stress is one of the main things that can hinder your milk supply. So these are things that maybe individuals might not know. And it's really helpful to have somebody there with you. They can also be an advocate for you. We're here to talk about Black women. We're going to be very honest. The minute you walk into a healthcare space or you go to a hospital, they already have these preconceived notions of you. She probably won't want to breastfeed anyway. So, we won't even have you talk to a lactation consultant who's there in the hospital, who is ready to help you. And you are charged for these things as well. That bill, when you deliver your child, they charge you for a lactation consultant to come into your room. So that person can be there to say, no, she is very interested in breastfeeding. They can help you fit a pump correctly. They're just a really great resource to have. So, and IBCLC is internationally board certified lactation consultant.
Thank you. And then I think one that we don't talk about enough, and Katherine, we shared briefly about the work that you do with Operation Mist and the technology that's there to support mamas and help prevent some of the concerns that we have is, but can we talk about pelvic health therapists, right? Because that is your other passion. Share with us what that means, because I know for a fact many doctors don't talk to mamas about it. And then when they get to my age, they're all, then they want to tell us about you guys. But tell me beforehand, right? So let's talk about that.
Yes, ma'am. And so, so another thing that we do, because you talk about, yes, we do more than a period parties where we talk with young ladies. The ladies have actually ranged from age 7 to now 78 at our parties. And we just teach them how their bodies change over time, especially their pelvic floors, and how things like posture and blood flow and stress and trauma can impact the functionality of it. So when we're talking about our pelvic floor, we're talking about the muscles that are between our hips, okay? And they have 3 main functions, and that's what we talk with moms about, and that's how we help to support. The first layer would be sexual pleasure. And so because that first layer can tear during vaginal deliveries, that can impact our pleasure with sex. And so PTs help to make what's supposed to be pleasurable again. The second layer stops women from peeing and pooping on themselves. And so those muscles are supposed to let you go when you need to go and allow you to hold your urine when you're not ready to go. And so whether it's surgery that's been done, in pelvic surgery, maybe you've carried a baby, so it doesn't have to be that you delivered vaginally, but if someone even delivered via C-section, there is scar tissue that can block the nerves from the top of the body from getting down to the pelvic floor. So women with C-sections can also have urine leakage or leakage of feces. And then if you have a tear, then that can also impact that function. And the third layer is supposed to help with support. So it keeps everything that's in the pelvic floor where it's supposed to be, or that's supported by the pelvic floor. So your intestines, your rectum, your vagina, your uterus, all of those things. And so if it's not strong, then it can cause those things to move out of place. And just like a mailbox that doesn't have numbers on it, the brain has a hard time finding and controlling that function if those organs are not where they're supposed to be. So we teach women how to get those functions back. And a lot of people think that you have to have an internal assessment. Someone has to put a finger inside of your vagina to be able to assess you, and that's not true. And so we like women to know that we can see a lot of things from the outside. We don't have to open up someone's knee to help them rehab after knee surgery. So we don't have to go inside of a woman to help figure out what's going on, what's causing her to leak, have pain with intercourse, pelvic pain or low back pain. We can just get in and sometimes see how long are you sitting during the day? What is your posture like? How is your breathing? The diaphragm moves up a little bit during pregnancy. And so if we're not doing that deep breathing and putting it back into place, it can negatively impact pelvic floor function. And so we're also just teaching, how do we restore the balance after we have babies and prior to having babies? Where is that balance? If we have weak abs, tight low back muscles, we exercise a ton and maybe have a lot of tension in our pelvic floors, it can make it really difficult for us to get pregnant and to stay pregnant, to deliver a baby vaginally. So we just try to establish a baseline. Where are you? Where are your pelvic floor muscles? And how can we get them right before we have a baby?
Thank you. So there's some planning that goes involved. That sounds like, right, with pregnancy. So Dr. J, let's talk about some things. So if I'm saying this statistic right, about 50% of pregnancies are unplanned. But that means there are 50% of the pregnancies that are planned. So if we're planning to get pregnant, prep is isn't about fear, it's about power, it's about knowing and being empowered to interview whether you want a midwife or an OB, and what do those, how do I find a charity in my community, or how do I find a Dr. Kat in my community? But let's talk about some quick things that one can do to prepare for pregnancy. Fact or fiction? Let's play that game. Smoking and drinking. Can I still smoke and drink when I'm pregnant, or not even when I'm pregnant, when I have a possibility of getting pregnant, or I am preconception?
Okay, drinking, I would say if you're drinking in moderation, no binging, no heavy drinking. If it's an occasional drink, that's fine, but you have to be mindful. During pregnancy, we don't know how much is too much. So, like you said, 50% of pregnancies are not planned. So, people find themselves pregnant unexpectedly, and you want to make sure that you're not in a place of regret once you find that out, because you're thinking about, oh my God, what have I just done? What did I do 2 weeks ago or last week? You don't want to feel like you've had, too much alcohol a few weeks ago and now you're worried. As far as smoking, smoking is not good for you, no matter if you're pregnant or you're not pregnant. So that's something that is you should try to stop or get help with. There's a lot of medications and therapy right now and support groups that could help you stop smoking, and that would put you in a better health to enter a pregnancy, and just for your long-term health, if you never get pregnant, that would be fine.
Thank you. Okay. This is not a true or false one. What is a supplement that I should take or start before getting pregnant?
Okay, there is a vitamin. It's called folic acid. It's found in multivitamins, and if you just take a regular multivitamin that you can get in any drugstore over the counter, 400 micrograms a day would help prevent a birth defect called spina bifida. The baby's brain and spinal cord development starts at 4 to 6 weeks, and many women don't know they're pregnant at that stage. So by the time she finds out she's pregnant, the baby's spine and brain are already developed. So that's something that we encourage. As soon as a young lady has her menses, she should be on a multivitamin daily. That's just a good thing just for her overall health, but that will also have her ready for a pregnancy down the road.
Okay, so folic acid, prenatal vitamins. What's the thing about getting tested for STIs?
I think that it's very important to have I'll call it a preconception visit with a provider. And I know young women, they're busy, they feel fine, they don't feel the need to take time to go see a provider, but it's such an important visit where they go and they talk about their family history, and they can go through any medications they may be on. There's a lot of people that are on medications for mood elevators, for blood pressure, for epilepsy, different disorders that they're on medications. They need to talk to a provider and make sure that those medications are safe during if they were to get pregnant, would it be safe to be pregnant on that medicine? I'm not telling anybody to stop taking their medication, but make that appointment with a provider, a nurse practitioner, a doctor, a midwife, and go see them with a list of your medication so you can have a discussion about that. You should be tested for STIs and HIV. That's very important. The worst thing that can happen is a woman finds out she's pregnant and now she's finding out she has other things going on. She should have her pap smears up to date. She should, if she needs a mammogram, if she's of that age, she needs to make sure she has a mammogram scheduled. You don't want to wait till you're pregnant. And the most devastating thing that I think I found is that during a visit where a mom found out she was pregnant, she also found out that she had some health issues that she was not aware of. I'm not sure if I just got kicked off the webinar. I'm not seeing it all of a sudden. Can you hear me still?
We can hear you.
Okay,
we can see
good.
you as well. Oh, that's
Okay,
but you
I
don't
just
see
lost
us.
my screen. Yes, so it's very important to find these things out. It's very important to find these things out ahead of time so that you can enter a pregnancy with your full knowledge of your health and get things under control before you enter a pregnancy.
Thank you, Dr. J, for getting us started on, what do we need to do to prep, right? I remember someone saying a year or so ago in one of these workshops that we plan for our weddings, years in advance. I planned for my daughter's wedding for like 3 years. And it was the wedding, a little testimony, because a young woman that came to our wedding went to the guy that founded Starbucks. Look, you said our wedding, my daughter's wedding. His son got married a few weeks later, and just officially for the record, she said ours was better. So anyway, I digress. We did not spend that much, but it just had a feel. But it took years to plan. But then when we talk about getting pregnant, as Mikayla alluded to, we just think it's natural. I'm just going to get pregnant naturally. I'm not going to have any test. So let's talk about that whole concept of body literacy, right? And Dr. Kat, I'd love you to talk about it because you mentioned that you have an initiative where you talk about the body and you talk about, young women and menses. So what are some of the things that we need to understand about our body before we get pregnant?
So I would like to go the route of vital signs. So why don't we go there? Because I love this book, and I can't remember what it's called, but it talks about the blue zones, and they talk about how, with people who live to 100, they're not running into the diseases that we're running into here, like diabetes and high blood pressure. And their whole thing is we need to move more, eat better, rest more, and stress less. And so I started thinking about that. If we just all implemented those things prior to getting pregnant, then we'd show up a lot healthier, because when you listen to cardiologists, they talk about how pregnancy is nature's stress test. And so if there was anything going on pre-pregnancy that you did not detect, it can definitely become exacerbated during. And that's why I love there's a dad on here. The Miss Dads are in charge of this in our organization. So if a woman gets pregnant and she wants to get pregnant again, he's the one that implements these 5 things. So I'm going to share it with you all. In terms of moving more, research says that 7,000 to 11,000 steps is great. And that's why I love the smartwatch. You can track that. Now, if you're told that, we had a mom who was told she had to go on bed rest, and she was able to negotiate with her provider so that we could watch her stress and see, well, how many steps can she take so that she can still move and still be safe. And it ended up that 1,500 was the magic number for her. So it's not that everyone should just take 7,000 to 11,000 steps. It's that you should see, how does your body respond to it? And then in conjunction with your provider, you can see if that recommendation is good for you. Okay. Sleeping 7 to 9 hours a night. I always say the hormones take the night shift. And so if we're not sleeping at night, but we're expecting our hormones to be balanced, we're expecting to get pregnant, it can be difficult if the hormone balance is off. And then another thing, I know that Dr. J talked about alcohol. Alcohol does throw off your levels, the levels that you need to reproduce. And so for those people who are drinking daily, it can really throw things off. And then for us, we see a spike in stress so high, sleep quality goes in the toilet. Drinking is not the best thing on a regular basis if you're trying to conceive. And so we try to sleep 7 to 9 hours, but that's good quality sleep. So lights are dark, room is cool. We're not eating 2 hours before bed, especially not heavy meals. We're off the screens for 30 minutes before. And that way our body can jump right into the cycles that they need to get into for us to have good quality sleep. We also want to try to drink half our body weight in ounces in water. And so I know some people, when they get pregnant, they have a hard time keeping water down. And so we also say, hey, try to eat your water. And so if you're eating vegetables, right, watermelon, celery is 95% water. And so you may not be able to drink it, but making sure to eat it, because during pregnancy, our kidneys work up to 50% harder starting at week 20. And so if we're already in the habit of nourishing our kidneys and our bodies with water, then it just becomes easy to continue that cycle when we get pregnant. When I hear people, and we talk to them at 16 weeks, they're like, oh, I hate water. I'm like, hate, that's a strong word. Water didn't do anything to you except support your body up until this time. And so let's start loving water before we get pregnant. And then also looking at our resting heart rate. So if you look at the research, they say resting heart rate should be between 60 and 100 beats per minute. And that's really telling us how hard is our body working when we're doing nothing at all. And on a smartwatch, you're able to see that. You can just look down and tell you what your resting heart rate is. Typically, if you don't have a smartwatch, that's fine. As soon as you wake up in the morning, all you have to do is put your finger here or on your neck and you'll feel a beat. And if you do a timer for 60 seconds, you'll be able to see how many times your heart beat, how many times, yes, your heart beats in 1 minute. And if you're between 60 and 100, this is why I always tell people, you don't want to shoot for 100, okay? Because during pregnancy, your resting heart rate is going to go up by 10 to 20 beats per minute on average. We've had some women who are super healthy, they only go up by 6 beats per minute, meaning that their heart is not working that much harder. But for those that go up by 20 beats per minute, imagine if you're resting at 100 beats, now your heart is beating at 120 beats per minute every single minute, whether you're sleeping, you're moving. It's not good for your body to have to work that hard to deliver oxygen and nutrients, transport hormones, get rid of toxins. We want to get that number down, and the way to do that is to stay active. So we try to get people to stay active. And then in terms of stress, just removing any unnecessary stress. And I know it's hard, and I know Mikayla, is the queen of social determinants of health, just trying to figure out how do we address these things so that we're not having unnecessary stress, because we know some things we can control and some things we cannot. But if we know that we have stressors in our lives, just trying to remove them and get into a state of rest before we get pregnant. Those are the things that I would recommend from our body standpoint.
Thank you. And speaking of, these are all good. I'm going to drop it in the chat, the 5 things. All the numbers didn't go, but you guys will see it. And stress is critical. I don't know who wants to answer this one, but no, I'm not going to go off on that tangent. I can be attention deficit. I won't do that one. But I was going to talk about stress and weathering. But before we go there, let's stay on topic. Charity, I'm going to assume, so we're doing the 5 things that Dr. Kat has shared with us. We are drinking our water. That'd be a whole lot of water for me to drink half my body weight, but all right, girl, I'm going to do it. We're drinking our water. We're doing all that. What are some things that we should also do in terms of, before we're in the moment? What are some things that we should consider in terms of the questions we should ask our practitioner, or the things that my partner and I should talk about, right? Because you made a comment that some people may not realize is that there are options for births. As Dr. J mentioned, there are birth centers. In some states, it's legal to have your birth at home. But what are some things that we should consider from that perspective? Charity?
A lot of things I normally tell clients to consider is, of course, one, you really do want to consider your health, right? Thinking about where you are in your health, because that's going to affect the kind of care you're going to receive. Are you low risk to no risk? Are you mid risk, or are you high risk? High risk being that you had some sort of condition even prior to pregnancy that increases your risk, going in, right? And knowing what those factors are, that can affect, so you don't set up a birth plan, or I even like to personally say preference, because I feel like when you say plan, if it doesn't go the way you plan it, you feel defeated, like you did something wrong, you've lost here, right? And that's my biggest thing as a doula. I say, oh no, hun, we're here to create your preferences, talk about things you desire in this birth experience. It's so much work that goes into it, especially knowing about things that you don't think is a factor, but it shows up in pregnancy. Something you didn't think about, maybe a relationship with someone like your mom or something. Maybe it's not the best relationship, things like that. And as you're going further on to this pregnancy, into this birth experience, these feelings, these emotions, these things come forward, right? So getting, I would say, your mental health together, or even starting to have those conversations, building those relationships. And again, looking to see what options are available for you, especially within your area. I usually tell people, if you got to go more than 15 minutes to receive that care, that's something you want to think about. What does that look like for you, right? What do you have access to that's near you? If you're a mom who's low risk, it's your first time, potentially, we'll go a first time or low risk to no risk, you definitely can qualify, if legal in your state, for a home birth or a birth center birth. And with that being said, knowing what you would like to do if your plan is to, as some say, go completely natural. And having that birth team around you, definitely getting a doula, because you're going to need someone to be there with that support and that knowledge to help you through this. Also making sure your partner and you are on the same page of what your birth preferences are. And then bringing in whomever else is going to be a part of this birthing experience with you, being on the same page. I can't begin to tell you how many times I've been in a room where partner, mom, me as a doula, we're all on the same page here. But then here comes grandma, or the mom of them, who's like, I don't see why she trying to do this. This is terrible. If you don't get that epidural, you know, oh girl, this is crazy. Or bringing up their birth trauma without realizing they're actually bringing up their birth trauma at that moment and literally placing those feelings on that person instead of showing up and supporting them how they need. No, what she needs for you to do right now, Ms. Rose, is be her mother. She needs you to love her. She needs you to hug on her. Like, this is what we're looking for. We're not looking for you to come in and tell her, that's why I told you you shouldn't do this. No way. This is crazy. And I can tell you like how many times it happens, or not just beating up on the grandmas or the partner, like you're just sitting here doing nothing. You haven't tried to prepare for this birth experience. It's a marathon, not a race. It's a lot of work in here. Don't underestimate the work that you're about to do in order to bring this life forward. So to wrap that in and bring it home, preparation is key. Think about your entourage. As I tell everybody, I'm like, you want to look at yourself like the Avengers. Mom is the Incredible Hulk. I get to be whoever you want to be. I usually consider myself Iron Man, right? You know, and who all has their role in here. And as I tell the staff, wherever we're going to give birth, we have a Hulk. We don't want her to Hulk up. The plan is to keep her nice and calm, keep things moving steady here, and have as much as possible, a beautiful birth experience, but also understand that things can change because, as I like to say, life be life. And if something does arise that changes in that birth preference that you desired, being okay with, okay, here's what we could do, plan B. Maybe we can't get in the jacuzzi tub to labor, but we can get in the shower, right? You know, just be open to understanding and educating yourself throughout that experience on alternatives, what emergencies look like, and making sure, again, you have that full-on support throughout that pregnancy, especially that childbirth and into that postpartum experience.
Oh, I love that. We don't want her to Hulk. That's a good one. And it's so important to have, I think, you know, just from a support standpoint, you know, people will tell you nobody could love their babies more than me. But having someone who is grounded in that education, with, you know, because to me, I always said the doula is the combination of that smart girlfriend, right? She's gonna care for you, amplify your voice, support your body physically, and you know, and all that, and your partner. But then she also is going to know what should be going on. And I don't have to try to find my what to expect when you're expecting book literally while I'm in the midst of labor. So now we've talked about the pregnancy, we talked about, you know, the questions that we ask, but, and you alluded to this, Mikayla, we often think breastfeeding is just natural. I don't have to think about it. I have someone that I love dearly that she researched everything there was to know about her pregnancy, to the extent that she had a fight about whether she should take folic acid or not because it wasn't natural and all this. But then when it came to breastfeeding, it was like, oh, I can wing it. It's natural. I don't need what? So tell us, why do we need to do a little bit of prep work before we, you know, in order to breastfeed? And then also, and human milk versus breastfeeding, our human milk chest feeding. What are the benefits? Let's ground our audience in that too.
Yeah. Oh my gosh. I can't even begin to list how many benefits there are to breastfeeding. It's when you really get into it, you almost find yourself so amazed at what the human body can do. So first and foremost, your beautiful little bundle of joy is susceptible to all these bacterias and viruses, because imagine they were held safely in your womb for a considerable amount of time. Now, within a blink, they're now in a new environment. So your breast milk is equipped with antibodies and vitamins and so many things, even stem cells, to really reinforce your baby's immune system. That's why you hear a lot of people say, you know, my mom, I hope she's on here, but my mom, she is the first one to be like, I breastfed my child for 3 years. She was a superhero in that. And she'll always say, you know, my child was rarely sick. Growing up, I didn't really get sick. It's because all of those antibodies that are in that milk that really helps your baby's immune system. There are fatty acids in your milk that helps the development of your baby's brain and your baby's eyes. So oftentimes you'll hear, oh yeah, breastfed babies are smarter. This does not mean that if you give your child formula that they will not be smart. It's not what I'm saying. But there are components in the breast milk that are a lot better for your baby's health overall. And breastfeeding from mom too. There's this hormone called oxytocin. It's known as the bonding hormone. Sometimes you'll hear moms, they'll say, ooh, I loved breastfeeding because I feel this connection with my baby. And that's what that hormone does. Not only does it help connect you to your baby, you have this beautiful connection with them, but it also helps you produce more milk. So the more you breastfeed, the more your body will be like, okay, this baby really needs this milk. Let's produce more. So there's so many benefits to breast milk and breastfeeding. But also it's important to kind of get more knowledge ahead of time. Because again, I will always tie this to Black women. We have so many barriers that we face when it comes to breastfeeding. First of all, we have a very traumatic history. And I encourage people to read up on this and really do your research. It's not easy to read, but it's important so you know where you come from and where you're trying to go. With our history, when we were back 400 years ago as slaves, we were doing something called wet nursing. Essentially, our slave masters, they wouldn't allow us to breastfeed our own babies, right? So they were forcing us to breastfeed their children. Why? Because one, they're realizing that breast milk is very beneficial and it's healthy for the baby. They're saying, okay, these babies are living past 1 year old, 2 years, 3 years. This is something that's good. Two, there was a stigma, or there still is a stigma with breastfeeding. You know, if you're breastfeeding out in public, you're socially inferior. Like, what are you doing? You know, and now something that's supposed to be so natural and beautiful is now seen as something strange and weird. And then thirdly, like I said, breastfeeding is a lot of work. So for those women, they couldn't be bothered to do it. So they had, you know, property who could do it for them. So as a result, you have a whole bunch of babies who are becoming malnourished, or Black babies who are becoming malnourished and even passing away. So that whole thing that we went through becomes very traumatic. And that's a trauma that has been passed down from generation to generation. So now you have a lot of women who have this adverse reaction to breastfeeding. So that's already a mental thing that we have to get past. And in turn, you end up having a whole generation of women who don't know how to breastfeed, or they didn't see anybody breastfeeding. So for me, going back to my mom, I had women everywhere in my family breastfeeding. It was not strange. You're eating dinner, there's a breast out. And someone is breastfeeding somebody in the house. It was normal. But I had to recognize that that's not everybody's experience. So I think I went a bit off tangent. My brain does that. But it's so important to go ahead and prepare yourself, learn about your history and some of the barriers that you will have when you go on this journey. That's why we're here. You know, you even if you didn't have a mom who breastfeed, you didn't have an auntie or grandma who breastfed, you have a whole bunch of professionals that will be there. We're gonna rock with you and encourage you to make sure that you can do this, and to encourage you to let you know it is possible. So did I answer the question? I'm so sorry.
You did beautifully. You were talking, you weren't looking at us all nodding, and we were doing that. We were becoming your amen corner. And I know we've dropped some gems. There have been some gems in the chat. I want to open the floor for the audience if there are any questions from our audience members. And while we're waiting for, I'm going to screen those, and as I'm doing that, I'm going to share some of the points that our speakers. One from Dr. J about speaking with your family members to learn about your family history. Mikayla alluded to the importance of family history or cultural practices in terms of your success with breastfeeding. And we'll explore that together during Black Breastfeeding Week in a deeper, richer context, because both Charity and I are from the Midwest, and we were like, oh yeah, not seeing it happen can affect and having Mama and them say, you know, if that boy can't afford to buy formula for you and that baby, why'd y'all get married? That was, you know, a whole other experience. But talk to your family members, not only in the context of what is your family history, but I would submit, talk to them beforehand to say, look, I'm going to breastfeed. Before you're vulnerable, before your hormones, early in that pregnancy, let's establish with Mama and them, I'm going to breastfeed. And I want your support. I don't want you to say, let me slip that baby some formula. Let me slip that baby some rice cereal because he's not sleeping. So
Mm.
please,
Yes.
okay, Sharon and I really are from the same community.
Oh my goodness. I'm in New York and that
They
happened
do
in
that there
New
too.
York.
Oh, I thought it was just a, you know,
Yes.
Southern
First,
thing.
first night
What is
home,
the
cereal
what
in
is
the
the
bottle,
obsession
first
with
night.
feeding babies? What is the obsession? Like, this baby is 4 months old. That baby don't need no green juice. Like, what are
None.
you doing? Why are you giving juice from your greens and then it's your spoon? It's like, Lord, I love you, but
There,
the things I see
and I
sometimes,
can
and
speak
that's
to that one as an old Southern woman. There was a thought that hot liquor, which is that the juice from your greens, that they thought it carried like this magical quality or whatever. But no, I was not an advocate for it, but I do know where it comes from.
Where it came
So
from.
there's some wives' tales. I'm like, I'm all for it. Like, you know, binding your, you know, taking care of mama, making sure she's
Yeah.
getting warm substances, that 90-day period that a lot of cultures and many countries in Africa have that period where mama for 90 days, they're really coddling her. Those
Yeah.
historical cultural things, let's embrace them wholeheartedly. The pot liquor, no. Give mom
Yeah.
pot liquor if you want
I'll be
to.
like,
But
they be
no,
waiting for the holidays to get their hands on that baby. You gotta watch. Like, don't tell her, don't feed. No, the baby can't have no sweet potatoes. Okay, the baby just got here. Stop it.
no,
Don't get a baby diabetes. Stop.
Yes.
with brown sugar in it and butter. I love this point that you mentioned, that you included charity. Never underestimate the amount of work that goes into breastfeeding. Yes, it is natural, and we're all for it. We advocate it. Even infant formula companies, they used to, I don't know what they say now, they used to say that breast milk was the gold standard because human milk has so many properties that even with the advances of science, they cannot replicate everything. It took years and millions, if not billions of dollars for them to only be able to replicate. I think it's just one or two now that are in formulas, oligosaccharides. But breast milk it's a natural, not a natural, it is truly made for your baby. Breast milk changes over time as your baby ages. Breast milk changes through the course of the day. It truly is magical. So but at the same time, understand that you have a learning curve. Your baby's going to have a learning curve, and you benefit from that support. Dr. J's point about taking care of your health prior to getting pregnant. Yes, make that preconception visit. Go in and have a conversation. Understand, I was just sharing, I don't remember if it was on this one or not, with about a young mom that I was talking to who had several losses. But there was nothing done in terms of identifying why she was having the loss. But push your doctor to, you know, if make sure you have, like my daughter knew that I was going to have some, because mom had challenges. And so she went in saying, I want to run all these tests before I even get excited about the possibility of getting pregnant. And while that's she's like a very quantitative person, maybe you don't have to go that extreme, but at least go in and say, I want to make sure my body's going to do what it's supposed to do. So there are no surprises. Katherine has a point about gummies. Prenatal gummies, they don't have an iron supplement. I would also advise looking at the young woman that I was mentioning that was so natural. She was taking a natural prenatal vitamin that did not have folic acid because it had a supplement of folate, which is a precursor and all of that. And there's some question about one's ability to absorb folate, and are you going to get the benefits that you get from folic acid? And then the last point, I think, from Dr. J about alcohol in moderation, and then not smoking. And I don't care what everybody says about marijuana or CBD or whatever. And yes, it may be legal. Cigarettes are legal. Alcohol is legal, but that does not make it right for your baby. Questions from the audience in terms of, let me go there. One of the questions that is about, I think it came from you, Dr. Kat, about reducing stress. Can we talk a little bit about, we know that there are social determinants of health, or there are things that affect our level of stress, or they affect how our health outcomes, right? Where we live, our income, access to care. But the truth is with Black birthing people, you can be the Serena Williams, right? And have all of those resources, and still your outcomes can be worse than a white woman that doesn't have a high school diploma. So sometimes it's not the matter of what's in your checkbook. Can we talk about that a little bit, Dr. J, Dr. Kat? Anyone that wants to, Mikayla, I didn't say it very well, but y'all know where I'm going, I hope.
I would like to first say that we do have a higher mortality and morbidity rate, and a lot of it has to do with bias and systemic and structural racism. And we have to, that's just what it is. And we have to acknowledge it, and we have to do something about it. One of the things that I try to do to mitigate this is I try to educate healthcare professionals about implicit bias, because implicit bias is bias that is, it's an automatic thought that just pops up in your mind. It's not something that you think about and say, I'm going to treat these people different. When you leave home in the morning, most providers, I don't think, leave their house and say, I'm going to treat people different. But when they get there, they actually do. And so to have providers actually recognize that they are biased, because we're all biased. And if they learn what bias is, and then they can say, okay, that thought that just popped in my mind, that wasn't right. Take a moment, think about it, and then they'll make the correct decision if they would just stop themselves and not act on that first thought. When I do my conferences, I always start off with myself and how I realized I was biased. And it shocked me because I didn't realize it at the time, and I didn't even know what to call it. I was in my 20s when it happened. And I have to tell you, it was a shocker for me, but it taught me from in my 20s. I have to see the person in front of me, and I have to hear them and see them and listen to them. And then I can make a determination because of our interaction, not because of a preconceived thought, something I saw on TV or how my family heard something different. It's there in all of us. So I think that's one of the first things that we need to do. And like I said, educating. I did a program called Black Mothers Interrupted, and I was educating medical students and midwifery students and pre-med students about bias. And we actually go through a thing where they do some exercises where right in the conference they realize, oh my gosh, I thought that I saw this. No, you didn't see it, but your brain told you that's what it was going to be. So, you know, that's one of the big things that I find.
Thank you, Dr. J. And that's a whole conversation.
It is.
We're gonna have to do a part 2. I don't want to miss this question because this was a big one that we see. How does PCOS affect a woman that's trying to get pregnant? And what special considerations should she have? Anyone or everyone?
I'm going to say again, that pre-conception visit, making sure that she's being monitored by a provider. Many women with PCOS have diabetic symptoms, so that needs to be monitored and controlled there. The diet, some of them are on insulin and that sort of thing. A lot of times women with PCOS are overweight, and so that may be a big part of them having problems trying to get pregnant. So monitoring and trying to stabilize their weight, it needs to be followed prior to trying to get pregnant, because that is a big concern with them.
Mm-hmm. Mm-hmm.
I'd also want to add to that too. The thing with PCOS, it's all about hormones. A lot with just our bodies in general as women. But with PCOS, you're constantly battling just hormone imbalances.
Yeah.
And that affects so much. You know, you need hormones to get pregnant. The egg quality, your eggs, they rely on your hormones being balanced. So really taking care of yourself and doing things that aren't really going to throw your hormones out of whack, so to speak. One of the lovely panelists mentioned it, alcohol. Alcohol is one of the things that will throw your hormones off balance. So I know sometimes you want to do a little wine night with the girls, I understand, but it's definitely something to take into consideration. Yeah.
Yeah, I was going to also say in terms of the stress that I know that Ms. Marie alluded to it, that our bodies age faster. And some research says it ages 7 years faster than white women. And so when we think about stress and how over the course of pregnancy, stress levels increase, but the thing that's really off really is the body's ability to go from rest and digest to fight or flight and back. So like normally if you have a stressful event, then your body goes through the motions to address the stressor, and then your body just calms right back down. But while the stress is being addressed, your heart rate is going up, your blood pressure is going up, your blood sugars are going up. And so the hope is that that stressful event goes away quickly enough that your body recovers. Well, during pregnancy, the body just has a harder time of doing that as the pregnancy progresses. And so when we talk about stress, it's not just negative stress, it's exercise is stress. Eating is a stressful event for the body, but if you eat poorly, then that stress carries on from breakfast to lunch to dinner and now into your sleep. And so when we're trying to reduce the stressors, if it is financial, then let's try to save up before we get pregnant. If we know that we don't have maternity leave, because the body for the first 2 weeks after delivery, the blood pressure system has a hard time regulating, which is why you see the blood pressure spikes between 3 to 6 days postpartum, but you see a lot of deaths within those first couple of weeks. And so if people can keep the mom's physical stress down, and that's why, you know, as dads, just seeing, okay, yeah, maybe I can stay up all night instead of mom waking up every time. That's a role that we've seen dads take on, and women's stress goes way down. Their blood pressure stays regulated. Sometimes it's honestly, and I know this is hard, but doing FaceTime visits for that baby's first prenatal or the first visit to the pediatrician. When we see that mom's heart rates are up, their blood pressures are up, their stress is up, then maybe someone else needs to take baby for that first visit, and you FaceTime in, because it's or you push it back. We've had moms to do that too. And, you know, you would have to discuss that with your provider. I know my midwife, she came to me and it was wonderful. She came to us for all of our visits. And so it just made it easier. We didn't have to get up and leave the house, because people talk about the value of loving on the mom and serving her and stuff like that. But the way the healthcare system is set up, we're in the doctor's office within a couple of days following delivery. And so we have to figure out, how do we keep our stress down in the midst of a society that is moving very, very quickly, because our bodies are not always up for the challenge.
And that's a great point that Charity, you put it in the chat. But I want, if we could take a minute to talk about the body. And as Charity says, you know, we need to understand that our bodies are not the same. You've baked a tiny human. Charity, would you elaborate a bit more on that?
Absolutely. Because what I hear a lot of in our, you know, from people, you know, oh, we've been having babies for thousands of years, you know, since the dawn of time. And I'm like, and you're right, I love that for us. However, with that being said, you have to also realize over this time, how have we as humans and humanity evolved? How has our lifestyle changed? Like we were saying, so a lot of us, let's be honest, in American culture, we're like the unhealthiest we've ever been, right? So if you're comparing yourself to hundreds of years ago, where these women were still under stress and things, right? But active, constantly moving because you were forced to, because you were in a field, or, you know, you worked in a job that constantly caused you to, whether you're cleaning or doing things, you were physical, right? And now we're in an era of technology, which is a win and a, you know, a loss here sometimes when you think about it, because we're not as active as we used to be. So when you're comparing yourself to others, and our diets, you know, we overeat. Let's just be honest. We either don't got enough or we eating too much. It's literally no in between some days here, or don't have access to healthier options. So sometimes what I've really seen to notice is a lot of people are dismissive, just like we were talking about with breastfeeding and all these things. You normalize what, yes, should be considered the norm of what the body generally is made to do, but you forget the changes that have come with our current time, our current stressors, the things we face, again, the unhealthiness. These are all things that are affecting your pregnancy, which is why you do see people having higher risk, or things developing. You know, these are all things that are playing a factor, as well as now you add on the systemic biases and the racism and the social determinants of health. It's just piling things on, which when you come into it, that's when you say, well, how can somebody like Serena Williams, you know, have an issue and she's rich? You know, that's where it's like, okay, because at the end of the day, it's still Black. Right. But then for the rest of us who don't have that income, now you got all those other things piled on you. So I say that to say that instead of sometimes within our own selves and our own communities, we become so dismissive of data and research and understanding what's happening with our bodies. We're not asking the questions, like we said, we're not preparing ourselves, trying to be in the best health before even trying to conceive, let alone the complications of things that could possibly arise even after. So I'm big on it. That's one of the things that means more to me is educating the community on health literacy so that you now feel empowered, to go again. I know we got to distrust in the medical system, but I said, no, you need at least 2 physicals a year, right? Men and women, like get your health checked, understand the basics of healthcare, right? Like, don't just take any pill, ask a question. Well, why am I taking this? What effect does this have? Like the simple questions, get out of that superiority or like white coat syndrome where this person is not a person of authority. That's another human being. And I want you to always look at it. Even me as going into the role of midwife now, I still tell people, I want you to look at me like still another human being. I am Charity. I can make a mistake. I want you to ask me anything if it does not make sense to you. I want you to, we need to be meeting people where they are and putting in terms that does make sense. Yes, keep professionalism, but it's nothing wrong with sometimes taking off your white coat, sitting down with someone and like, look here, girl, this is what this means. All right. And this is what we do it. And I'm gonna get this blood pressure cup and you gonna check your pressure. You gonna talk to me. All right. And they like, okay, cool. Right. Just meeting people, evolving and going where we are. And that builds community, that creates that safeness, that creates that love. And just again, getting in our communities and encouraging that health literacy so that we can promote health and having that historical education on how we got here. Now, what can we do to change it and better ourselves?
Oh,
Charity, I am in love with what you said because it's all about cultural congruency. It's all about it's a conversation. That's the one thing I remember. I used to take medical students and midwifery students in my office, and I would just have them sit to the side and I would be interacting. I would like to take them on like a new visit, someone I'm just meeting for the first time. I said, you have to learn how to approach a new client, how to get their information, how to put them at ease, how to start that relationship. I said, they're not going to tell you everything until they feel comfortable with you.
Exactly.
And it's a conversation. And by the time they would leave, the student would say, wow, you just met this person. And I was like, yeah, because you have to do that, because walking into an L&D, for instance, you may walk into someone who's in labor who's never met you in their life, and now you're their midwife that shift. You have to establish that relationship right from the beginning and see them as a person and include their partners and the family and the doula and everybody and get in there and let her know it's your baby, it's your body, it's your decision. I'm here to help monitor this. I'm here to give you the information so that you can make an informed decision. That's my job. And to make sure that everything is going according to specs, okay? That's my job. Your job is to deliver this baby and have the most wonderful, joyful delivery and experience that you can have. And we're going to all work together as a team to make sure that happens. That's what we do.
Agreed. I always tell everybody I got about 5 seconds to make an impression, and I got about 30 to 60 to lock you in. And from there, now we gonna open these doors and go. But if I don't get it in that first 5, when I walk in and say, hey, if they will look at you and say, she gotta go. You'd be like, you sure all right, let me leave out. Let's try this again. But first impressions matter. And that's how you build those relationships, those safe space. So even if things not going exactly how they want it, if you create that love and that self space, or self space, Lord have mercy, Jesus, that safe space and creating that comfort, you get better outcomes. At least they feel like they know that this person actually cared. And that's important.
it is so important. Ladies, can you believe our hour's up? But I don't want us to leave without each of you, one quick takeaway you want our audience to remember. And we will share this recording. We'll share the links to all of the panelists and any resources that they have available. But quickly, 30 seconds each. Dr. J, what's your final takeaway for people?
I just want to leave everyone with the knowledge that you're going to make just a preconception appointment. No matter when you get pregnant, you want to do this now so that you have time to talk to your provider and you get everything straight. I want to make sure you start taking a multivitamin with folic acid daily. I want you to pay attention to alcohol consumption, keep it to a minimum, and try to stop smoking. Ask for help. We're here to help you do that. And keep your stress levels down and just plan, because you can enter a pregnancy in the best health possible and with peace. And so you can go into a pregnancy with joy. That's what we want for you.
Thank you, Dr. J. Mikayla?
Yes, this was amazing. I know we briefly mentioned social determinants of health. So just for everybody to know, that's basically those are factors that aren't medical that can also impact your health. So we're thinking about like education, access to healthcare, your environment, the social context, economic. But my takeaway is that social context piece. That's why I'm absolutely in love with what we did here, because we're providing that space, FUBU, for us, by us. So, so you want to make sure that the people who are around you, that's your tribe, that's your community, your partner. I read a study recently how in everything, in breastfeeding, in birth outcomes, your partner has a lot to do with that. If they're there encouraging you and telling you, you can do this, and they're researching with you, that can create such an impact. And even if that partner is not there, your chosen family, right? Your biological family or your friends, those are people who can really be there for you. And even if you don't have any of that, please, I think I can speak on behalf of all these ladies here. You are more than welcome to reach out to any one of us, and we'll be there with you and provide you that information that you need. So I hope everyone enjoyed, because this was amazing.
It was indeed. Dr. Kat.
I was just gonna say, keep showing up for the knowledge. Love that you all are here. And also, we always tell our moms, know the research, but research yourself, because there are going to be things out there that may or may not apply to you. And so know yourself, and then also look for a provider who will pause. I know a lot of us, and I love Black people very much. I will tell you that the midwife who caught my blood pressure spike was white. She knew me from my previous pregnancy, and she noticed that my blood pressure was 128/78. Some providers would have said, well, that's a beautiful blood pressure. She said, Katherine, that blood pressure is different from yours. You're typically 100/60. We're going to look into it. She did. We continued on with we ended up having a natural induction at home. So I was able to have my baby, even with the diagnosis of preeclampsia, at home. And so she just supported me where I was. I would not say that's the safest thing to do. Always you have to make that decision with your provider. But I do want you to know that when things are caught early, you can intervene. And then the last thing I want to say is that our bodies were designed to give birth, and we want to support the design, just like a car runs on gas. If we put water in the tank, we wouldn't expect the car to move. And so we have to decide, what are we going to do for our bodies so that they can do for us what they were designed to do? And as support people, we can help hold our birthing people accountable for doing that.
And speaking of support people, Charity, close us out.
All right, I got y'all. So I'll just say, get you a doula, sis. All right, and sex responsibly. Okay, because birth too dangerous to be just having babies for anybody. That's what I got.
That's all she got. But that was a word.
Yep.
A whole other
Get you a
shirt.
doula, sis.
That's a whole other shirt. And I would be remiss, my friend at Brianna at Stoop and Stank, I don't know if you guys are familiar with Stoop and Stank. It is they're a whole vibe. They have these wonderful shirts. My daughter found them during the pandemic, and they have shirts that say the Black girl will save the world, and something about protect your edges. Seek your peace. They have wonderful sayings. And so we are excited that they've designed a shirt for Birthing the Magic. I don't know if you guys can see it.
Stand up a second, Marie. Stand up. We can't see the whole thing.
We just have the conversation that I'm business at the top.
I did. No, I remember.
Okay, can you see it? But you can find it on our website. Thank you guys for this. Thank you for our audience. You guys have been so engaged. And I know some of you in our audience are new expectant mamas. Some of you are practitioners. Please join us. Reach out to join the Birthing the Magic Village. I'm going to invite these ladies back. There's so much that we didn't get a chance to talk about, and we want to. And within not even 30 minutes, in 20 minutes, we are going to continue this marathon with a phenomenal panel. And we're going to talk about beyond the birth. What happens after the baby's born? And this is a group of brilliant nurses. And so we're going to cover some of those little, maybe hard to hear things, but we know they are a reality. Beyond the birth, postpartum risks and realities, not to scare anyone, but to inform. So join us in 20 minutes, 18 now, for another lively conversation. Thank you, Charity. Thank you, Mikayla. Thank you, Dr. Pat. Thank you, Dr. J. Thank you, audience, and we'll see you guys later.
Thank you.
Bye, everybody.